Health Education Lecture Series. All the listeners of Health Education Lecture Series, I'm your host, Gurdeep Singh Sandhu, homeopathic consultant. My clinic address is 9701 Sarah N. Court, Dublin, California, 94568. Phone number 408 687 1899. Anytime, if you are suffering from any disease at any age and you are tired of any treatment, you want to get second opinion about your disease and also the treatments, you can call me at 408 687 1899. I can guide you according to the nature's process of curing this body and making it healthy. Even when there was no medical science, even then people were suffering from diseases and they were getting cure as well. And the nature was having its own course, how it was curing the sick persons, sick bodies at that times. And the medical science has also followed those rules, those pathways, how the nature was curing, how the diseases were getting reversed into the health stage. So that medical science is still not gone away, though there are many more things we have added to that medical science, and nowadays doctors have generated many other alternatives, and those alternatives are basically not, I'm not scared of that saying that those alternatives are not natural. They are artificially made, they are made according to the need of the time, but more than the need of the time, it is just urgency of the time, you can say. Nowadays in the modern words, we want to do everything, everything as fast as we can do. And as fast as we can do means we are doing something wrong against the rule of the nature. Nature has its process. You cannot command the sun, you cannot command the moon, even you cannot command the earth as well. But you can watch that. You can watch that, how they are running, how they are moving, how they are making day and nights, but you can just watch them. In the same way, before the medical science, this nature was also curing the diseases of the sick persons, and that was having its own course. How the disease enters into a body, how a person becomes sick, and then after that, how a person becomes healthy. So that was nature's process, and then we have to follow that nature's process, how nature was doing that one. We can learn that, we can follow that, but in case of our urgency, in case of need of the time, just you can say that this need of the time, because we are making our need according to our present world. We are not making the need according to the nature. So in this way, when we are creating some alternatives to the nature, they are not perfect. Always we have to suffer for that. The only way, which is perfect way, that is the nature's way, and that nature's way has its own course to cure the diseases, and we are following that. But as far as we forget that, or as far as we denying to follow the nature's rules, we are suffering from many of the diseases, and we are basically complicating the health process, complicating the disease process as well. And ultimately, even centuries back, if you go back, there were not much diseases, and nowadays the name of the diseases, even the doctors are finding and tracing out from the dictionaries, that what may be the name of the disease, and whatever it is the name, what it indicates, how many organs are involved in this disease, and what are the functioning has been involved in one disease. So this is what they are trying to find it out from the dictionaries, whereas the simple explanation for the disease was this is. Not easy. I'm not easy. I'm not feeling well. And then when you explain the not well, not feeling well, according to your own senses, these are five senses. We have different five senses. Okay, eye, ear, nose, tongue, and genital organs. These are our sense organs, and even the skin is also considered with that one. That's also a sense organ. And in this way, uh, according to their demand, according to their needs, if you want to work according to that, then it will be a natural way. But you want to go, or you want to cover whatever the symptoms are in a fast way, so that you can match with the modern way technology. You can match with the modern day working of the human race at this time. And human race is to do things as fast as they can, and every day that as fast as you can is increasing and increasing, increasing. And we are trying to that time period we're concerned, we are trying to make it zero, but it is not possible. When you do things like that one, if you have to travel from one distance, from one city to the other city, there is a distance. And that distance, when you are going by walking, there was no incidents, no accidents. When you are going by cycles, there are some incidences will take long time. If you go by car, it will take short times, but there are still chances of accidents or any other expenses incurred. Cycle has minimum expenses. Car, motorcycle has more expenses in that one. And ultimately, if you go fast by train or by aeroplanes, yes, you can cut down the time periods, but it's more expensive and it's dangerous as well. The same thing is with the medical science. We are trying to cut down the time period of any disease, and that process is making complicated our health. And most of the things which occurred later on, because of our urgency, because of our demand of the time, we do the things and then we suffer later on. And suffer sometimes, that suffering, you can and that produces losses, we cannot compensate that. Suppose if there is accident and you have a broken bone or some other injuries, that's not reversible at the time. That will take more longer times. And in this way, same way in the medical science, the treatments we are employing, treatments we are using nowadays, with the mentality that we want to do the things as fast as we can, we are going against the nature's rule. Na- because there is a speed, just as I told you, there is a speed of the earth. As this earth is moving and how it is moving, there is a speed of the moon. He is moving as he is moving. Okay, so these are the natural things which you cannot change. The same way, body, its origin, its development, its falling sick, its curing process, it depends upon the natural law. Because many time I told you in these lectures that, suppose if you go to the doctor, your first question is, doctor, what's the disease? What's the name of my disease? And basically, it's a vague question. Disease is what you tell the doctor. And then your second question is, basically your disease, whatever you tell him, this is my complaint, that is the disease basically. And doctor has to just name it. That, oh, this the symptoms, oh, it will name it. And ultimately your second question to the doctor will be, doctor, how long it will take to cure? How long it will take to cure? This is your second question to the doctors. And the qualified doctors, learned doctors who have gone through the anatomy and physiology of this body, means how this body is structured, how this body is functioning, means physiology, and ultimately how this body is recovering from diseases itself. That's a process, that's a system. And according to that system, I have explained many times in these lectures that doctor will tell you what type of disease you have, what type of organs it has damaged, how far the damage has gone to the tissues, and what type of tissues are damaged. I told you there are different kinds of tissues: epithelial tissue, connective tissues, bone tissues, muscle tissues, nerve tissues, and all the tissues are having their separate repair period. They can fall sick by injury directly. They can fall sick because of some other disease developing inside the body. But ultimately, when they are damaged, when they are affected, after that, when you go to the doctor and you ask the doctor how long it will take for me to cure, then the doctor will figure it out how many types of tissues, how many types of tissues has been damaged, and then what is the repair period naturally, because it's not the wall that you will cover it from outside. You will put the mud on the wall and it will be recovered. No, regeneration of the body is always internal. With the treatment, what you do, with the treatment you protect him from all other next coming epidemics or next coming any infections. Just like we put bandage on the wound, what you're doing, or you apply some medications in that. That medication is not repairing the wound. Wound repair will be internal. That's a different process. But it will protect you from the external and reinfection or double infection, so that this already wound should not be infected with an another infection of the environment. So this is what the medicines are using and all that one. But the repair period depends upon what type of tissues are involved in this injury, in this wound, or in this incidence, or in this disease. So according to that, yes, I told you, if in case of any epithelial cells are damaged, just like epithelial everywhere in all the organs of the body, the internal or inner layer of each and every organ mostly is formed by epithelial cells. Epithelial cells are very soft, very easily repaired, and very fast repair. Within 3 to 7 days, it should be repaired. But if it is not repaired, it means something is complicating this repair process. And you have to find out that one. Just like sore mouth, there are ulceration inside your mouth, and the ulceration inside your mouth should be recovered within 3 to 7 days, depending upon the ulceration of the epithelial cells in the lining of the mouth. But if this ulceration inside the mouth is not recovered within 3 to 7 days, it indicates something is causing problem. Something is blocking the way of repair, the normal process of the repair. And you have to find out those ways, those things which are causing hindrance, which are protecting the disease process, not the health process, or this tissues are not repaired. In this way, for that cure, you need to find out those causes. Suppose, if we are here, because our chapter is up to the skin, but even then, I would like to explain this thing, but it's necessary for you to know that If mouth ulcers are not recovered, I told you the epithelial cells are damaged, and these epithelial cells should be recovered within 3 to 7 days in a normal. You take hot tea, you take hot vegetables or something like that, and have sore mouth. It should recover within 3 to 7 days maximum. But if it's taking longer time, it means something else other is adulterating this process. Something other is blocking this process of normal nature's way of curing these ulcers inside the mouth. In this way, you have to find out those causes. Suppose if a person is having acidity, regurgitation, all these heartburn, just like all the most of the people are having, and if the acid is coming up into the mouth, those ulcers will not be repaired. The same thing happens in the stomach ulcers. They take longer time to repair. Though the linings of the stomach are made up of epithelial cells, repair should be within 3 to 7 days. But if peptic ulcer, gastric ulcers are lingering on, are not cured within a specified period, it means number one, the causative factors are additioned. There are some additional adding of the causative factors which are causing these ulcers to worst more and more, more and more. They are going more and more. And ultimately, these causative factors may involve not only the epithelial cells, it may cause the underlying tissue that may be of the muscles, that may be of the nerve muscles, and the ulcers may become deeper to involve the other type of tissues at that local area. Then automatically it may take longer periods. So, under these conditions, the first thing is to find out the causes which may complicate the disease. Even in general environment, we have to find it out the normal way of doing any things. And if that thing is not being done within a specified period, we have to find it out what is causing, what are the hindrances, blockages, that this process is not going on in a normal way. And until we eradicate those type of causes, we will not be able to do that. In this way, everywhere the repair process, the doctor will tell you when you ask him, doctor, how long it will take for me to cure. So it depends upon the damages of the tissues, what type of tissues are damaged, and what time period is specified by the nature to repair these type of tissues. Just like the bones, when there is a broken bone and you go to the doctor, doctor said, okay, we will put a plaster on it for 6 weeks. Why they say 6 weeks? They can say for 4 weeks, they can say 8 weeks, something. Why? Because they know the pathology, they know the process of repair by nature, that bone takes about 6 weeks to repair. So that's why they maintain the process free of other infections. If even they give any medication, infection does not mean that it may become outside. It may be from the outside, just like the outside wounds. But wounds is internal. There is no external injury. Injury is internal. But still, there are many more type of bacteria entering, going, circulating through our blood, and ultimately they can infect our wound of the bone, wound of the other muscles, and all that. They may complicate, and that may take a longer period. So, doctor knows about the normal period, repair period of each type of tissues, just like epithelial, connective tissue, bone tissue, muscular tissues, nervous tissues. So all these tissues are having their different repair periods, and that doctor knows. According to that, in the first point, he will tell you it will be recovered within this period, and whatever treatment is giving to you is not directly to repair that. Basically, he is protecting you for another infection which can complicate your injury. And nature has its own process to recover those wounds, those injuries, those infections. And then from outside infection, we cover with bandages. With the inside infections, we cover with the medications. So process of all treatments what the doctors are prescribing for you is to protect you from another complication of the disease, whatever you are suffering from. So whatever you are suffering from, it depends upon the tissues, what type of tissues are damaged inside the body, and we know that how long it will take time to repair if there is no any other complication during the process of treatment, during the process of repair of those tissues. Nature himself will recover. You know, who give medications to the birds? They are flying. Who give? But nowadays we have doctor, animal doctors, this doctor, that doctor. But previously there was no doctor for, even for the human beings. There was no doctor in the initial stages back. But ultimately, as the human knowledge grows, we have started these type of medical science, that this thing we can do, in this way we can protect. But nowadays, modern times, we are not thinking that we can do this and that. No, we want to match with the fast word. And fast word is that, oh, if you have a headache and tomorrow you have to go, because of your liabilities you have to go to the jobs, and ultimately what you will do, you are sick, you are having a headache, you have some problems, you cannot go to the jobs, but you have to. Then what you will take? You will take some painkiller or some type of medications which will stimulate your body, and you go to the job. It's not repairing, it's not recovering, it's something suppressing, it's something overactivating the power, reserve power of your body. When we use the reserve power of the body, when normal power has a time period to do the things, but you want to do this things fast, and then you use your reserve power. But after the reserve power, ultimately you have setback. In this way, whatever medications we are using, they are helping to fast the process. And the fast the process does not mean it repairs the things. No, repair again. Repair is internal. There is a process of repair. What type of minerals, what type of vitamins are required for the repair, just like we say vitamin C, vitamin K, and all these things we need to repair the wounds, internal wounds, the external wounds, and all that. And those are provided by the food, those are provided internally by the natures. But externally, whatever we do, internally, whatever we give as a medication, it's all to protect you from reinfection or any other complication of infection with these wounds, so that these wounds may be more complicated and will not be repaired in a short and in a normal periods. So in this way, nowadays, modern days, we are combating with the time periods, we are combating with the world, and world is going fast and fast. No matter what happens, we have to do this work within this specified period, and we have to advance, we have to match the world. The same thing is happening in the medical science, or even the mentality of the patient itself is that, okay, whatever pain I have, whatever disease I have, I want hook and crook, immediate relief from the things. And when you apply something to give you relief immediately, ultimately you have to pay for that. Ultimately, your health has to pay for that. And lingering on, ultimately it complicate your normal flow of life in your body. That's why there are many more diseases. Previously, there was not that much diseases. The disease was the only disease, not easy. I'm not feeling well. And the simple things were, I cannot sleep, I cannot eat, I do not want to eat, and whatever, all these things, simple things were. But now these simple things are complicated because of our fast processes, and then we are suffering with the other complications. And complications ultimately they are forming some residual things inside our body. Some residual things are remaining inside the body, and our vital principle is not capable of regularly residual process of the disease inside the body, and ultimately it is making a huge garbage, and that huge garbage is damaging many of the function of the many of the organs. And ultimately doctor ne, oh, you are having AIDS, you are having arthritis, you are having diabetes, you are having cancer, this and the all these things. They were not the normal process of the disease, they are not the normal process of the tissues to go, but they are there nowadays. Then who brought these things? We we brought Dr. Davidson. We were studying pathology in our student life in the medical colleges, the pathology of the Boyd, William Boyd. Uh, that Boyd, he says, diseases are made by these are human made diseases. Most of the things which we follow, just like pneumonia, bronchitis, arthritis, cancer, psoriasis, all these things are human made. They were not previously there. We have complicated it with our go fast process. We want to go for everything fast to match the world. Or it has become our responsibility, you can say, and it has become our you can say duty to compete it within the specified period. You cannot avoid not to go to job. You have to, because there are expenses you have to hold for your household expenses, your children's expenses, and many other things. And for that you cannot spare the day without going work. You have to. And when you have to, ultimately you will manage it by hook or crook, by using some other complication things, medicines. And then ultimately the body will say, no, I cannot, hands are up. And then the doctor will say, you have, oh, dreadful diseases. So this is what going on in this process. And today, as we are discussing systematically this body structure, how it was formed from cell onward, and cells are uniting, they are forming tissues, and tissues are uniting, they are forming organs, and organs are uniting, they are forming systems, and they systems are uniting, they are forming the whole body. And the collective function of these systems, there are 9 systems working inside the body. Collective functioning of all these 9 systems generates a normal life. And if ever any of the component, any of the organ, any of the tissue, even any of the cell even falls sick, is unable to perform his duty by one or the other means, then ultimately the life process represents himself with some abnormal indication which are not normal. Normal indications, many times we explained that the respiration should be 14 to 60 times a minute. Blood pressure, as an average, we are taking that 120 by 80. Cholesterol, we are taking maximum 200. And the different components of the blood, neutrophil, basophil, monocyte, eosinophil, they are having their own percentage. That's going normally. But when something is complicated, under those conditions, your vitality expresses himself that this is what I cannot do. This is what I need additional help. And additional help you take with the medications, which is again complicating. Suppose I can give you the example. Suppose you keep night watching by work or by doing watching movies or in whatever way. One night, 2 nights, it's okay, no problem. The body can bear it easily, and you can overcome it with this one. But ultimately, if this has become a routine and you are bound to do that under those conditions, ultimately one day your body will show some signs that they are deranged in their functions. The normal function is not carried out by your vitality, and ultimately that is known as a disease. That's so. After many nights you cannot sleep. Ultimately, you will not feel hunger. You will not feel appetite. You will not eat that. And even if you eat that, then it will not digest inside your body. It will not digest inside the body. Ultimately, the normal process of the digestion, assimilation, making the blood, and all that will not be carried out. So this is what going on. We do not know. These are all simple things. These are all simple things, but we never think of this thing. We never think of this thing, that this is so easy to understand, so easy to follow, but we are bound to the modern words, competing the things, competing in a shortest time. This is what making a problem for us. And every day new diseases are coming up. Every day new names are of the diseases are coming up in front of us, and we are dread of those names. So let's come to the today's lecture. Today we have to discuss about the disease, because we have discussed about the cell, its components, cell membrane, what are the duties of the different components of the cells, ultimately all the different tissues, what type of the tissues we have, what are their duties, just like connective tissue, what is the duty of the connective tissue, what is the duty of the epithelial tissue, what is the duty of the muscular tissue, in this way. But all the tissues are having cells, and all these cells are having a definite type of components, and all the components have their definite duty to perform in a cell. And we have discussed about that one. And ultimately we are discussing about this skeleton. When this whole body, whole structure has been formed, we have discussed about the vertebral column, bones of this body, and importance of the bones of this body. And after that we have discussed about the joints. We have discussed about the different kind of joints and what is the possibility, why these are different kind of joints, because of the movements, because of the requirements, how you want to move the body. In this way we have already described this thing. And after that we have discussed about the plexus, the main pillar, vertebral column. Then we have described the shoulder girdle, then the pelvic girdle, and what are the components inside the shoulder girdle, and what are the components of the pelvic girdle, what are the organs they contain. And we have discussed about the trunk as a whole. Under the head there is a neck, and under the neck the whole body up to the legs is known as trunk. And this trunk is divided into, first of all, two portions. The one is known as chest, the other one is known as abdomen. And then again abdomen is divided, because chest and abdomen you can see from outside that this is chest, this is abdomen. They have their different descriptions, and ultimately they have different organs, they contain it or they protect it. And ultimately then I described about the abdomen. It has also internally two parts. Externally it looks like the one only abdomen, but internally it has two components. One is the abdomen proper, the other one is a pelvic organs. And the different pelvic organs are contained in the pelvic area, and different organs are covered in a wrap that's known as peritoneum. Inside the abdomen, we have described everything about this one. And after that, we reach to the skin. Now, skin is the largest organ. It's also an organ, or it's also explained as tegumentary system. Tegumentary system is also known as the skin system. Means when a system is explained, suppose if we say respiratory system, it means it starts from the nose, air goes inside, goes to the bronchus, goes to the larynx, goes to the lungs, and all that. It comes backward from the same point up to the nose and goes out. This is one system. In this way, when any organ is performing this type of system, this type of complete work over, that is known as a system. So, skin itself is a system. Skin itself is the largest organ of the body, which wraps up the whole body and is a largest organ, and is also a largest system because it has a complete incoming, complete outgoing system from the skin via different ways. I will just explain to you about this one. So this skin, first of all, I told you about the largest organ is heavy as well. As a one organ, no bone is that much heavy. Even not liver is that much heavy. Even not the brain, total organs are not that much heavy. Even the intestines are not that much heavy. But if we weight skin, that's the heaviest organ in of the body, not in the body, of the body, because it is outside the covered. It was okay. So, so the largest organ of the body, largest system of the this is suppose liver. Liver is the organ. It's a part of the digestive system. Stomach is a organ. It's a part of the digestive system, but it is not a system. Whereas the skin itself is a system as well. Skin is an organ as well as it's a system. And system means a complete turnover is going on inside the skin. And that complete turnover goes into the skin. We will explain one by one all these things. And that's also whatever the function is carried out by this one is a vital function. Is a vital function. And vital functions are considered those functions. If those functions are failed to run normally, they create a big problem. They create a big problem for life. That I will explain you one by one. So first of all, I can tell you this skin you see, it has main three layers of the skin, because we know inside the bone, inside the bone we know the bone marrow, and the bone is covering the bone marrow. Above that one, these are some muscle fibers attached to that one. The fat is attached to that one, bones, and ultimately it is attached to that portion is known as the hypodermis. And from the hypodermis, there is a portion that is known as dermis. And from the dermis, there is a upper and outer portion which we see, everybody can see that, that's known as epidermis. Now reversely I will tell you. We have started from inside, from bone marrow, to bone, to muscle fibers, and then to the fat, and hypodermis to dermis, dermis to epidermis. So this from inside, okay. But if we start from the outsider skin, whatever you see, that is known as epidermis. And epidermis is the outer layer of our skin, and the outer layer of the skin has a peculiar type of connections, peculiar type of discolorations, peculiar type of you can say functioning. Peculiar functioning means anything. It's just like we have described filter. You do filter things, and whatever the filter you use, sometimes it can do the reverse side. The same filter can be used on the other sides. From one side, water, liquid, whatever is flowing to the other side, but from the other side, under some conditions, it can flow backward. But the skin is a different kind of mechanism, that internal things like a sweating can come out through the skin. But suppose if you are swimming, and if you think that the water will go inside your body, it will not. Water will not go inside your body. So it's a one-way traffic, you can say. The one-way traffic is that the outside things cannot go inside and harm the organs, but some of the inside things can go out, just like sweating. I will explain the mechanism of this function of this skin, because what's the mechanism of this one. So first of all, let me explain you the three layers. The first layer, what you see outside on your skin, it has a different type of colors, and these different type of colors depends upon the melanin layer of each individual body, or each individual person's skin. Just like some of people are black, some of people are very reddish, some of people are pale. It depends upon what happens. The mechanism of this thing is that when blood goes to each and every cell inside the body, it goes to skin as well. It goes to skin as well. And at that point, whatever is required by the cell of the skin is taken up or eaten up from that blood, and the wastes are sent back. Oxygen hai, food stuffs hai, because to maintain the elasticity, as we grow bigger, as we grow taller, and the skin maintains the same thing. There is a ratio of in nature that it provides the same type of food material, so that it can grow according to the length of the bones, and it can grow according to the tissues or organs inside it. So in this way, it needs daily foods, everyday food, and that food is supplied by the blood. And when the blood enters into the skin, then materials are taken up, eaten up by the cells, and the waste materials are gone back to the system. But there is a glitch. Some of the some of the RBCs, some of the blood, you can say, as a whole, remains there as a residual. As a residual, just like if you filter tea in your kitchen, and ultimately you throw that tea bags. But if you see that tea bag, it has still moisture in that one, means tea is still there. The same way, The blood comes from the heart, goes to the skin, and there it supplies the food, and it takes the waste of the skin, goes back, but some of the residual portions of the solid blood remains over there. That give color to our skin. And just like peoples who are living in the hot areas of just like African countries, they are black, and in cold Western countries, they are, you can say pink or you can say white in this way. And we are having in the Middle East area, and our you can say it's wheat colors. We are known as wheat colors. So all these colors are depending upon the malign layer. That malign layer means whatever the solid residual remains inside the skin when the blood goes back, taking the wastage of the skin. So it depends upon that one, that it gives the color to that one. So in this way, it depends also from the external heat or hot environments. It changes. Even if a white person is regularly living in the heat areas, ultimately his skin color will be changed. In this way, it also depends upon the external things, because that even if the blood is shed of outside, after some times, first of all, the blood is red, and after some times, it becomes brownish in color. Ultimately, it becomes black in color. So, in this way, this blood changes the color, and it depends upon the environmental heat. And in the same way, this residual portion, whatever remains inside the skin, has effect of the environment, and then it changes its color and gives color to the skin. And the other things about this one I have told many times. When from the food you take, it goes to the intestines, and from that one, the iron is absorbed. I'm just talking only about the iron. There are many more things we absorb. Ultimately, it goes to the blood, mixed to the blood. That blood goes to supply each and every organ, and again it supplies to the intestine as well. And then there is it does not mean that intestine can because first of all the food goes to the intestines, and intestine will take whatever it needs, and then the residual portion it will send to the circulation. No, not at all. It's also supplied the blood according to the rule of the general rule of the body organs. In this way, then circulating blood is supplied to the intestine, and when that circulating blood is supplied to the intestines, and then from there, the intestinal blood, after supplying the food or all other components, goes backward, just like the all the blood goes to the organs and then go back to the heart. The intestinal blood do not go back directly to the heart. It goes to the heart, but directly it does not go to the heart. It goes to the liver. And that system is known as a portal system. And in this portal system, blood going from intestines, after supplying food to the intestines, after supplying oxygen to the intestine, and taking wastage from the intestines, it is going back towards the heart, but it goes via liver. It goes to the liver. And then when it goes to the liver subdivides its all components, whatever it has collected from the garbage of the intestines. And the same way, I can just give you the example, the iron. In the back going blood, there is iron. There are many more things, but I'm just taking one example of the minerals. That's the iron. So iron, whatever is collected, going back to the heart, that component has a iron. Then the iron goes to the liver along with other waste products, backward going blood. Then iron is subdivided into bilirubin and biliverdin, bile pigments and bile salts. And then it depends upon the how big quantity of the bilirubin, biliverdin is formed there, how much blood has been, how much iron has been broken down. And then if it's more broken down because of the heat, because of any toxic substances you have eaten, ultimately the excess of bilirubin and biliverdin, when they are supplying, it gives color to your eyes, it gives color to your skin, it gives color to your urine, it gives color to your stool as well. It depends upon that one. And similarly, it also changes. Internal process is the same. Internal process is the same, but external process is this skin is exposed to the sun. And then those things, the residual portion which blood is coming over here, even if a person is having jaundice, liver is damaged, it's not working normally. So ultimately, the same thing can go over there as a bilirubin, biliverdin. It will change the color even of the Negroes, even of the persons who are coming from African countries. It will change their colors, but it will not show up as it will show up in the peoples of the Western countries. Peoples of the Western countries will show the yellowness of the skin and color changed in the eyes, color changed in the urine, all that. And a doctor says, oh, you are having jaundice. But I'm talking about the functioning of the skin, that because of the residual remaining inside the skin, then when the blood is supplied to that one, and it depends upon the ratio of the residual portion of the blood which remains inside the tissues of the cell, that gives color to the skin. Pale, red, or yellow, or black. So it depends upon that one, and that has become according to the environment. In different environments, people are having different type of color of their skins. That is why, because they are there is a big portion of the residual hemoglobin portion that gives the color to the skin in this way. So there are two ways I have explained about this one: why the peoples are black, why the peoples are wheat colored, why the peoples are white colored. All these things, it depends upon the Malpighian layer, which is formed under the epidermis. So epidermis is the outermost layer of the skin, and this outermost layer of the skin, because blood is supplied to each and every organ, and this outermost covering is a vital layer which protect the outside rays to go inside the body and damage the portion as far as it is possible. It is helped by the dermis layer, and the dermis layer of the skin is the middle layer of the skin, because the epidermis, it is a type of, you can say, the waterproof. It's a waterproof, because if you are swimming, it does not mean that the whole water will go inside your body. No, even if you are thirsty, you can experiment it. If you are thirsty and you go into the water, you do not take into the mouth. Do not take into the mouth. Thirst will not be quenched, because the outside water, it's a normal rule of this skin. Yes, yogis and all the other sannyasis, people who are experimented, that yes, they are capable of doing this thing, this reverse process, that They can take food from the air, they can take water from the air and all that. Now there are many more people are experimenting it, but I'm talking about the normal process of the body. So normally, if you are thirsty and you go to swim in a pond, thirst will not be quenched unless you drink water. But sometimes you do not feel that much thirsty because the with the cold water inside the pond, the pores of the skin are contracted, and here the water inside the cells, whatever the residual portion of the water is, though it's showing the loss of water, it's showing loss of water and you feel thirsty, but ultimately that comes into circulations, and sometimes you do not feel that I immediately need water. Okay, but ultimately you need water. Thirst is not quenched by the swimming inside the pond. So this, you can say, the outer layer, epidermis, is a layer which maintains the tone elasticity. If the water is less, you will see there will be no elasticity. Lechak, you can say the elasticity will be less. Or, or sometimes, if you are living in the water for a longer period, your hands, you are working in the water, and ultimately your hands will show a wrinkles type of things that is known as a washerwoman's hand. In this way, the tone is lost. Okay, so epidermis is affected by the environment as well, but effect of this epidermis shows that the first attack of the outsider environment, it may be water, it may be sun rays, it may be ultraviolet rays, whatever it is, first of all, this epidermis bears the effect of that one, so that the internal organ should not be damaged. And if the internal organs are saved, it's all because of this epidermis. And the second is the dermis. And the dermis is the main actually functioning layer which grows hair. Also, which has sweat glands in it. You see, you have sweating, perspiration, and all that. These layers are not on the superficial layer. No, these are in the middle, in the inside. After the epidermis layer, there is a dermis layer, and it has glands which creates sweats. And when there is a sweat, just follow. When there is a sweat, you feel thirsty. In summer seasons, you are having sweating outside, and that sweating is going this way from this dermis layer to outside, and inside water is a deficient quantity of the water is deficient because most of the water is going outside from this one, and then you feel sweating, and then along with sweating you feel thirsty as well. But contrary to this one, if you are swimming in a pool, water from the pool does not go inside. One way traffic. So, this is the importance of this one. And today, my time is over. Still, we need to discuss about the hypodermis layer. So, there are three layers: epidermis, dermis, and hypo. Hypo means underneath, epi means superficial, upward. The first one. If we count it from outside, epi means which comes first, superficial layer. Dermis, the actually skin, and the hypo means under that dermis. So these are three layers, components of the skin, and they are having all their different functions to control many things. But we will complete it tomorrow. Tomorrow, our lecture will be in uh, perhaps Hindi, because We have already, yes, this lecture regarding the skin, we have not given in Hindi or Punjabi or all that. We will decide in one language, whether maybe it in Hindi or Angrezi, sorry, Hindi or in Punjabi, either of the two languages. I will give this lecture, explain more preciously, more widely to these subjects, that what are the layers, what their functions, and all these things will explain tomorrow. I'm Gurdeep Singh Sandhu, your homeopathy consultant, and my clinic address is 9701 Sarah and Court, Dublin, California, 94568. Phone number 408-687-1899. Anytime, if you are suffering from any disease at any age and you are tired of any treatments and you want to take second opinion about your disease or your treatments, you can call me at 408-687-1899. And if ever you want to be treated by a scientific homeopathic approach, you can call me 408-687-1899. Rabrakha, God bless you all. And again, I request to all of you that please make your members, relatives, nearest and dearest to join our Facebook, our YouTube, our Sabarang radio stations, so that they can and they can learn all these things for the beneficial of their life, their health, and all that. Rabrakha, see you tomorrow. Bye.